Good evening, Los Angeles. Tonight I'm speaking to you from Dodger Stadium, the field of so many victories that has thrilled this city for decades, and here on the site of a new victory, the largest vaccination center in the United States of America. Let that sink in for a second. A week ago, this didn't exist. This site wasn't here, and now it is the largest in the United States. Since this site opened up last week, I've been here 4 of the 5 days that we've been open, working the line, helping solve problems, and work almost every job in this distribution process, a highly complex process of amazing people that have resulted in getting thousands of people vaccinated. I've put together syringes, I've been a medical assistant, I've directed traffic, virtually everything alongside the heroes that every single day I've been working with. And let me say, first and foremost, it is these people behind me and beside me who are the heroes of this site. While Americans watched the inauguration of a new president yesterday, others were here on iPads, checking people in, moving them through, sitting in temporary trailers, drawing the vaccine into syringes, getting them distributed, and working all day and late into the night to get the job done. And then waking up, although some didn't even sleep, to get the job done again the next day. We've had firefighters who have worked 24-hour shifts, setting up trailers, coning car lanes. We've had nursing and pharmacy students who have come to a field setting for the first time in their careers, learning how to do a little bit more street medicine in a pandemic. And we've had companies like Curative and Carbon Health who have partnered to stand up technology and staffing to get this site running in record time. And with help from USC School of Pharmacy and LA Valley College, Glendale Community College, and National University, it has been truly the dream team. Every vaccine that we distribute here and in sites across our city and throughout our county is the beginning of the end of this terrible year that we've been living through. It is the hope about days ahead. It is a cure towards a resurrected economy, towards a restored Los Angeles. Kids back in school, loved ones close by, each dose an injection of hope in the future. You can't see them all right now, but those folks behind me, those heroes who are getting the job done, I want to thank them. And I've learned so much from them just in the past few days. Heroes like Els and the Zacks, Maya, Jacob, Wickstrom, Angelo, Lenski, Captain Gilbert, and so many others. And tonight I wanted to focus with you on what the City of Los Angeles, together with our partners, is doing to support the state and the county in our collective effort to get every Angelino in California vaccinated in the months ahead. And I want to invite you to sign up for direct, regular updates, because I know information is like liquid gold right now. To find out about vaccinations, to get the latest alerts as new people can come and get vaccinated, please go to corona-virus.la/vaxfacts. That's VAXFACTS. And sign up for that VaxFacts newsletter. And tonight you're going to hear from 2 outstanding partners who have helped get the job done. These 2 co-leaders, LA Fire Department Chief Ralph Terrazas and CORE CEO Ann Lee, who we'll hear from in a few minutes. The shots that are going into the arms of Angelinos here at Dodger Stadium and elsewhere in our city and county is our way out of this crisis. These shots are our way to save more lives. Every time, as I went home last night and fell asleep a little bit after midnight, I was picturing as I fell asleep each one of those vaccines on a cart that a clinician that I was next to was putting into someone's arm. I saw those tears in people's eyes. I saw that hope in their faces, and that collective will for this city to fight our way through this and to not just stand back up, but to start running again. Getting from here to there, a place where all of us are vaccinated, is going to take patience. It's going to take time from all of us. But we're working day and night to expedite this process, to deliver the more of these vaccines to more Angelinos who need it sooner. And we're making progress. Our city's vaccination strategy is built on 4 pillars: to deliver shots quickly, safely, equitably, and at scale. To deliver more shots more quickly to more people who need them. Some of this is not and will never be in our direct control. vaccine availability, production, national leadership. But I want to thank already the new administration who has reached out to us, talked to cities across the country, and who plans to stand up 200 plus sites like this around the United States of America, give direct aid to states and to counties and to cities, reimburse costs, because we know it's a small price to pay if it means one day earlier for our economy to open, one day earlier for our children to get back to school, one day earlier for us to finally hold our loved ones again. And we will always fight to make sure Los Angeles County and City gets our fair share from the state, from the federal government, and from manufacturers. The City of Los Angeles has been a partner in the County of Los Angeles' overall efforts to vaccinate Angelenos. Already, city sites have vaccinated more than 80,000 people at our 5 city-run vaccination sites. And this week, our centers have helped 46,635, a number that's literally changing every second behind me, to get life-saving vaccinations. That's a 90% increase in a single week. And here at Dodger Stadium last week, we developed our operational plan, got started. And this week, we started making those around-the-clock, daily, minute-by-minute adjustments and increasing staffing to reduce wait times and make the effort here more efficient. Once we're at full capacity, this site can comfortably, in the same hours we have here, help at least 12,000 people get vaccinated. Right now, vaccines are being administered to our healthcare, emergency service workers, and emergency workers, to residents and staff of our skilled nursing facilities, and I'm proud to say, as of this week, to people over the age of 65. And we're making progress. By the end of the day tomorrow, we will finish vaccinations for everyone in the city of Los Angeles who lives in skilled nursing facilities. And remember, at the beginning of this pandemic, 45% of our deaths came from those most vulnerable seniors, loved members of our families who lived in skilled nursing facilities. Too many people are still dying. And with more contagious COVID-19 variants taking root that may contribute to why we had such a surge in December, there is no task more urgent than getting this site and other sites like it to continue vaccinating our residents. As always, I'm going to tell it to you straight in each of these briefings. When I find things out, when we criticize ourselves, when we figure out ways to move forward. But the main thing right now, at this point, demand in Los Angeles, California, America, frankly, anywhere in the world, far outstrips supply of vaccines. Let me repeat that. Demand far outstrips supply. We are still waiting to learn when more doses will arrive, to know how many of them are coming even next week from the state, from the federal government, and from manufacturers. There's a long road ahead, and there will be only, though, each day, forward motion. No matter what the pace, we will keep adding people, more people to the number that are now vaccinated here in Los Angeles. That's a little bit more sunshine each day until finally the clouds have broken. And like everything in our COVID-19 response, from our testing program to our economic relief, we will use equity, which is just simply a way of saying fairness. That those who are being hardest hit, those communities, those ages, those workers, will be at the front of the line in every decision that we have power over, to make sure that those disproportionately low-income neighborhoods, where people of color live, where essential workers go home to sleep each night, that they get the help first. As we stand in the shadow of Martin Luther King Day, we're reminded that our commitment to equity isn't just limited to how we distribute vaccines. It should be a part of everything we do. To that end, and in the midst of the clarion calls for racial justice we saw on the streets of this country, I issued an executive directive last summer to advance racial equity across our city government. And we started implementing it right away, with equity officers in every single city department. Our first chief equity officer, Brenda Shockley of our city. And now we're taking the next step, the Anti-Bias Learning for Employees, or ABLE program, an initiative that will give mandatory implicit bias training program to all city employees. Because advancing equity starts with each one of us, looking inward, knowing our hearts better, and knowing where we can continue to be better allies in moving forward racial justice and racial equity. Dismantle racism for good, and continue on that pathway for justice for every Angeleno to make this truly a city of belonging. Progress on equity is up to each one of us, and I want every single one of the tens of thousands of city employees to own that mission. And there are currently those programs in some of our departments, like our police department and others, but now every city employee will have a yearly training on that implicit bias. Our progress on equity is also something that extends to what our work is here in our vaccination effort. Currently, there are 5 city-run vaccination sites among the 98 vaccination sites at clinics and healthcare providers, county sites, county-run sites on city property, city-run sites on city property, and here at Dodger Stadium. And I want to assure you that every shot delivered at each one of these places is safe and administered by a trained, trusted, qualified medical professional. Once you become eligible for the vaccine, you can find the information you need to make an appointment at city and county-run sites at coronavirus.lacity.org/vaccine. And if you want to go straight to the county site with all 98, please go to vaccinatelacounty.com. That's vaccinatelacounty.com. You don't have to live in the city to come to a city site. You can be a city resident of LA and go to a county site. We are together in this as a team to make sure wherever you work, wherever you live, you can get the nearest appointment to you. And if you aren't eligible for a vaccine yet, you can sign up for a regular newsletter and get those alerts as soon as eligibility expands. After you pick a location, confirm your eligibility, you'll be asked for health insurance if you have it. And by the way, if you don't have health insurance, that's not an impediment to getting a vaccine. And then you'll book your appointment. That's all it takes to get an appointment. The next step is what you do before you actually head out the door, before you get your shot. And here's how it works at Dodger Stadium. First, make sure that you have your confirmation form ready, as well as valid ID and your insurance card if you have one. And second, while we're deploying resources and new techniques to speed up this process, there may be a wait. So the vaccine process can take longer than our COVID-19 tests, for instance. So use the restroom beforehand, bring water and snacks, make sure your gas tank is filled up or your car is charged. Third, when you pull up at the entrance, staff will conduct a quick pre-check to confirm your eligibility that you have an appointment today and to check your registration before directing you to one of the 3 separate lots, 2 of which are open today and the 3rd opening later this week. Each one which is a self-contained universe of vaccination, a station capable of vaccinating up to 4,000 a day in each of these 3 pods. Once there, you'll line up in a row of anywhere from 10 to 20 vehicles, park your car, and wait for clinicians and other staff to come to double-check your eligibility, screen you for a risk of reaction, and then you'll receive the vaccine. You'll be asked to wait here for 15 minutes to observe those with medical conditions for 30, but to make sure that there's no bad reaction, and then you're free, on your way. The process is safe, but on the off chance that there's an issue, there's a team of LAFD paramedics that is here, stationed nearby to handle any complications. We even have gas if you run out. And once the waiting period expires, the entire row of cars is released to exit the test site, and you'll be on your way. Let me be clear. This is like driving a car at 60 miles an hour while building it. They're making adjustments to the system every single day. Yesterday, some of the brave folks who came forward, I know, waited for some hours. I worked that line, apologizing to people and listening to that. And this incredible team changed that. And today, the average wait has been 30 to 40 minutes before you're there getting your vaccine. Really an extraordinary turnaround, and I want to thank everybody who worked hard on that. This work is done because of our partners. And I didn't give a shout out to one of our partners yet, besides introducing that we have one of the CEOs of CORE here. But I want to thank CORE, who you all know I've talked about from the beginning, an extraordinary organization that has helped us from the beginning with our testing, and now with the vaccines. They have brought everyday Angelinos and turned them into everyday heroes. But right in our midst, we know the heroes that we see all the time. Rolling up in an ambulance or fire truck, folks who don't know the word quit or stop, they keep going. There's no challenge that they won't tackle, and they're led by an incredible leader. So these twin leaders of the Los Angeles Fire Department and CORE are some of the bravest and most incredible people I have ever been honored to work alongside. And we've had some long hours out here together. But first, let me turn it over to the leader of the men and women of this Los Angeles Fire Department and your Fire Chief, Ralph Terrazas.
Thank you, Mayor. I appreciate you inviting me out here today to talk about the great work of not only our fire department, but all our partners. We at the LAFD consider our COVID testing and vaccination efforts to be the most significant mission that we will ever accomplish, not only in our fire service careers, but in our lifetimes. This accomplishment would not be possible without our partners at CORE, Curative, Carbon Health, USC, the LA County Department of Public Health, and the Dodger organization. The men and women of the LAFD have been on the front lines of the fight against COVID since we initiated testing last March, when Mayor Garcetti decided it had to be done. His decision was in alignment with the LAFD's mission to protect lives and property, and we've taken it on with great satisfaction and great pride. Within our ranks, the arrival of effective vaccines has created a palpable feeling of optimism that the beginning of the end of the pandemic has begun. This optimism is shared by the people we are vaccinating. Almost universally, each person I have given the vaccine to has been extremely grateful and relieved that they now have some level of protection against the coronavirus. The LAFD is proud to be on the front lines with our partners as we work to protect the people of Los Angeles. Thank you.
Thank you, Chief. And as I mentioned, CORE's work has been absolutely extraordinary. It's integral to our vaccination efforts, and the more people we can add to it, the better. And I'm going to talk to you about how you can get involved and or support CORE. But I want to thank the Field Marshal of CORE, a woman who has been an inspiration to me, I know to her team, to our firefighters. And when Ann Lee and her CORE partner, Sean Penn, came to us just to open up a little testing site in Lincoln Park, we never imagined where we would be today. The biggest testing sites in the world, the biggest vaccination site maybe in the world right as we speak. And she's here tonight to speak about CORE's extraordinary work. Ann Lee.
Thank you. I just want to start off with a heartfelt thank you. First to the CORE staff who are pulling 15 to 20-hour days consistently, committedly to make this transition of Dodger Stadium from a mass testing site to a mass vaccination site. They're digging in after working hard this past year in testing to make this vac site the largest in the world. One of our best staff, who has also been working the line tirelessly from pre-check to check-in to site management during these 12-hour shifts, is Mayor Garcetti. When energy and exhaustion has flagged, seeing him in the trenches with us has been a boost to keep us going every day at this breakneck speed. We're grateful to your leadership and your example, Mayor Garcetti. Thank you. And of course, our tireless brothers and sisters at the fire department. Your doggedness to problem solve, to drive this logistical beast into fruition in less than a week has been nothing short of a miracle. We come to the site every day knowing that you guys got our backs. I've said this before and I'll keep saying it. The partnership between LAFD, the Mayor's Office, CORE, our clinical partners, Curative, USC, and Carbon Health, there's nothing like it. It lives and breathes the Haitian saying, "Men en pile, chai pas lourd," which means many hands makes the load lighter. For the public, we're asking you to join us. We're calling on folk to work as non-medical staff and clinical staff. We need you, and the city needs you. So for more information, please go to coreresponse.org. Thank you.
Thank you, Ann. You can count on me whenever I have a minute to spare to come back, and thank you for inspiring us so much. Let me repeat that for folks out there who want to get involved. If you have a little extra time, if you have a little extra money, if you can't give time, you're looking for meaningful work, because there's paid work here too, I'm asking you to serve. I'm asking you to serve this moment and serve your city and to be an angel in this city of angels with CORE. So go to coreresponse.org/serve. www.cityview.org/get-involved. And you can always donate there. Every time I say that, that critical work goes straight into folks who are here giving hope to our city. More vaccinations aren't the only hopeful sign, though, that we're seeing this week, after 6 or 7 of the toughest weeks of this pandemic. Today, the county reported 8,512 cases, 262 deaths. The last time we had 2 days of cases under 10,000 was in the first week of December. But I want to gloss over 262 deaths, as we know deaths lag for a number of weeks, and this is an unacceptably high number. Tragedy for too many families, many of whose survivors I've spoken to almost every day. You've moved me with your courage, with the way that you've gone into the hospital for the last half hour of a loved one's life, through FaceTime, connected him or her with their children or their loved ones. We know the toll that this is taking. But on the positive side, we hope that with these reduced numbers, the reduced demand for tests, which is also a sign of lower incidence, with an R0 or an infection rate now below 1 at an estimated 0.94, that fewer people are becoming infected here in Los Angeles than the surge that we've lived through in the last 6 or 7 weeks. Our hospitalizations still remain high, but down from our peak when it was over 8,000, currently 7,073 people, the 7% decrease since last week. And I want to thank our hospital staffs. We see you. Even as numbers go down, we know how stretched and how exhausted you are. And we love you and thank you for the life-saving help. We recognize the trauma that you see each night with our loved ones. This is progress. But as we've been reminded again and again, don't let down your guard. Whether it's a more virulent strain, whether it's a holiday surge, we have to do everything we can to remain vigilant as we roll out this vaccine and manage our healthcare system. As Dr. Fauci said a few hours ago, we are still in a very serious situation. So as we work hard with our new administration to ramp up our vaccination efforts, let's keep doing our part. Keep wearing a mask, staying away from each other. Even as the numbers get a little better, they're far worse than where they were just 2 months ago. To make sure that we don't hold gatherings, that we wash our hands, that we maintain our distance, that we work from home, that we defeat this virus and roll out this vaccine and see a day when we'll look back and our children and our children's children will ask us about the pandemic of 2020 and 2021. They'll ask us where we were and what we did. I just want to say to everyone on this site, I'm proud to be alongside you. And everybody out there, I'm so proud of what you've given our city and the courage you've shown. Keep that up. Stay strong, stay healthy, stay safe, and stay at home. Strength and love to you, Los Angeles. And with that, I'm happy to answer questions. Thank you.
Thank you, Mr. Mayor. The first question, as you said, it's all about supply.
Introduce yourself. It's Carlos Granda.
From Channel 7, Eyewitness News. Thank you, Mr. Mayor. As you said, it's all about supply. County officials say there are nearly 1.4 million people over the age of 65. So you have to double that number to complete 2 doses. But so far, about 850,000 doses have been delivered. By some estimates, getting just to that group vaccinated will take until June. What are your thoughts on how long this could take?
That's a correct calculation. And people, like I said, I'm going to say it straight. If you take the calculation of what the county is getting each week, about 160,000, and you just look at the number of healthcare workers and seniors, we won't get through them till June. Now, that pace won't stay where it is. Every manufacturer said we're going to be able to continue ramping up. There's new vaccines, AstraZeneca, Johnson & Johnson, the holy grail with a single dose if its efficacy is good. We know we will have more vaccines, so we won't stay at this pace, but that is a correct calculation. And by the way, when you expand that to the 7.5 million of the 10 million people that the Department of Public Health at the county level expects to get a vaccination, maybe not all of them will be 2-dose vaccines, but let's assume it's 15 million doses. We're talking about being in June 2022 at the pace here. So I want our state leaders to hear that. I want our federal leaders to hear that, and I want our private sector who is producing this vaccine to hear it. We are ready to do more here. It's going to be a sad day when I stand here saying Dodger Stadium has the capacity to take in 12,000 people, but we only have vaccines for 2,000. And when the second dose comes, if I say, hey, we still got as many appointments, but it's only for people with second dose. Nobody knew. That slows us up even more. So that is a correct calculation, an honest one, and it is the truth unless we get more vaccine. I believe we will get some, but we can't get it soon enough.
Now, from Ron Lin with the Los Angeles Times, are you concerned about the rise of the new Danish variant of the coronavirus that was identified by researchers at Cedars-Sinai and UC San Francisco that may be circulating more prominently in California? And should we be doing anything differently?
Absolutely, I'm concerned. I think I said 2 or 3 weeks ago this had to be, and we suspected that there was probably a strain that was pretty widespread. It's the only way to explain we were doing everything right. It wasn't that in Los Angeles people were spending more time at Thanksgiving than in Missouri. It was a moment in which something on top of everything we were doing right clearly contributed to massive spread. These strains generally haven't been more deadly, but when more people get it, it passes more quickly and more people die because of that. So I am very concerned. I think it does explain what happened in December, but I'm also thankful to see 2 days, knock on wood, where it has gone down to about 50% of our peak days, or even down by 2/3. If that holds, that's a good sign, but as a reminder, it's still way above where we were just two months ago.
Isai Rocha from LA Weekly asks, do you know if we're keeping track of vaccines that are being thrown out due to lack of use, or if they expire? If so, how many have been counted as unused or thrown out?
Here, almost nothing, and I witnessed that. That was the importance of coming here as a leader and not just coming in for a press conference. This is the last part of my work here. I've been working a number of 15-hour days. I could see at the end how carefully these folks from CORE, our USC pharmacy students, and LAFD make sure there's not a single dose wasted. Last night, after 7,730 vaccines were done at this site, which may be a world record. I'll leave it up to the press to figure out if there's been more, but close to. We didn't waste any. So if there was something left, we had new workers who were here. They're eligible. They got it. They are so careful to not take anything out of the refrigerator at that 10 o'clock hour when we went 2 hours over our closing time, and not to waste a single dose. I can't speak for other places, but that's how we're managing it.
Now, the next 4 questions are from Claudia Pescuda.
Only 4
Radio.
from Claudia? Come on, Claudia, you can give me 5.
How will people who don't have internet access or the help they need booking a vaccination appointment, or who can't drive to a vaccination site, are they going to get shots? What are you doing to increase the supply of vaccine coming to LA? What are the city sites doing to guarantee that people who got their first shot can get the second one? And it seems like a lot of people are booking appointments, which he feels is surprising given that Dr. Ferrer said earlier this week there are only about 50,000 slots available, and close to 1.4 million seniors on the county list become eligible for shots. How are so many people apparently being able to book appointments?
Great. Let me work backwards, and thank you, Claudia, for all of those. So this was the first site. We were vaccinating, by the way, both county and city were vaccinating people over 65 before they said everybody over 65 is eligible. And those have been at our skilled nursing facilities and congregate living settings, which, as I mentioned, is where we lost so many seniors early on in this pandemic, and the folks who are the sickest and at greatest risk because of their age as well. But then when it was expanded to all 65 and over, we became, I think, the first mass site to do that. I think the county went live today on 65 and over appointments. We started 2 days ago just because we heard it. We said, can we go? Let's try it. And I think it's a simple math question. Again, 1.3 to 1.5 million people who are 65 and over in the county of Los Angeles. I convened a group of mayors. We wrote a letter, which is part of the answer to your second question, to our federal government asking for more direct allocation to local governments, counties and cities. And Ron Nirenberg, my friend who's the mayor of San Antonio, said they had 9,000 appointments for seniors, 5 million people tried to, which is probably some people repeating, 5 million attempts to get 9,000 appointments. So this is happening everywhere in America. What we're trying to do is to bring some order, some predictability to it, and some honesty so that people know. And I hope that we can bring equity to it. I hope that we'll have tools to say, yes, if you're anywhere and over 65, you can get one, but let's give priority to those areas where most people are dying, living with essential workers in dense communities that are low income. Because those are the lives, I think, that we have to save. Those are the lives that are being taken from us disproportionately. So yes, that was here. We're able to continue doing it. I can't speak to why there's sometimes appointments available, but we're filling every single one of them, and people should just check back each day. We release them for a few days ahead. I think this site is through next Saturday already. There's a few that might still be open, and then in the day, If we have the capacity for more, we'll release a couple thousand more if we are getting through them quickly enough. In terms of managing and estimating, that's the science and the art of this is to try to predict what's coming. So that second dose, we can't today say everybody with a second dose anywhere in America, if you're also expanding eligibility, will be guaranteed to get it exactly on time. The good news is there's no longer an on-time sort of deadline. Pfizer has shown this, maybe Moderna. Worst case scenario, if production doesn't ramp up, it's still good for many weeks after to get the second dose. That is not my hope. I'm not going to push for that. I am going to answer the second question, continue shouting at the top of my lungs, talking to the incoming administration, bringing a coalition of mayors, state leaders, and others together to say we need more vaccines and to give them what we think is a reasonable request over time so that manufacturers can meet that. I'm confident we'll get more, but I do think the next 2 to 3 weeks will be difficult ones where we won't be able to meet the need to keep this going and people's second dose, if you will. And then finally, for folks who aren't connected to the internet, there's 2 ways, or don't have a car. Actually, this is a place where tonight we'll do probably over 8,000, but we're doing more than about 4,500 to 5,500 a day just through our walk-ups. In places like Crenshaw Christian Center, we actually there today ran out a couple hours before, but people can come in the morning, first in line if you were there at the end of the day. In San Fernando, at San Fernando Park, in Lincoln Park, and also, what's our fourth one? Fourth site, Hanson Dam. So those are places where people can walk up or drive to and then walk into. The throughput has been really strong, and the county has a number of those on city sites and other places that aren't the city of Los Angeles. Second, if you don't have a connection to the internet, there is a hotline that the county has set up, and that is also, we've offered and given some city workers to help them with that hotline as well. So I'll see if I can get that before the end of the press conference so I can say that to people in the press conference, what that number is too.
Okay, Bernard Wolfson from Kaiser Health News has 2 questions. Have city-run COVID testing sites managed by now to fully offset the loss in testing capacity caused by the end of the testing here at Dodger Stadium and other places? And was the decision to convert Dodger Stadium to vaccinations driven in part by the belief that ramping up vaccinations quickly is more urgent for the time being than testing?
So thank you, Bernard, for the question. I was very nervous about this. I spent a year building the strongest testing program in the country, and the idea of taking any capacity away from that made me very nervous in the midst of this outbreak. But as we saw the early numbers begin to plateau, the timing was perfect. So we had, for instance, 6,000 available testing slots. We've seen a drop-off of half or 2/3 of demand, which is not driven. We didn't close the number and say, sorry, you don't have any tests. Tests are available to folks, which means that I think this outbreak is coming down, and the timing of it was perfect. Second, we had in reserve, though, the capacity to ramp up testing if that demand continued, to be able to have our mobile teams that we have out there add 2,000 tests a day. We had plans maybe to look at Pierce College, which it looks like we won't need to open, and we already have a West Valley testing center. So that is holding beautifully. We're meeting the need, actually exceeding the need. In terms of whether it was more important, I think zero-sum game, yeah, to some extent it was. We saw that the vaccines will prevent and heal and finally resolve this. Tests are a critical piece of that. We didn't want people, especially with symptoms, to ever not be able to have a 24-hour same-day or next-day test. But working together with CORE, for instance, they said we don't have enough people to do both things. We took the risk here, and the biggest testing center in the world became what may be the biggest vaccination center in the world now, and it's worked out, luckily, quite well.
Coco McAvoy from Fox 11 News. Doctors confirm that the COVID-19 vaccine is not as effective without 2 doses. However, there are health professionals that are now up for their second dose, may not be able to get the second dose due to the shortage of vaccines available and the requirement to allow 65 and up to get it. What will the county, and I guess the city for you, do when some health professionals are unable to get their second dose? Is there a backup plan?
That would be better directed to the regulations that will be put out by the county, and I know how confusing this gets. These aren't rules set by the city because we don't have a health department. That's set by the county. But I have deep faith that they will figure out a way to make sure that people get second doses. And as I said, there may be, if there isn't enough production in the next couple weeks, there may be a lag for a couple weeks, but all the research has now come out, the guidance, official guidance for something like Pfizer, if it has to come 2 weeks after when we thought that date was, that's fine. It'll still have the same efficacy.
Now, Dinora Pérez would like a response in Spanish,
Okay.
so I'll ask it in Spanish. ¿Dónde se encuentra la ciudad con respecto al plan del presidente Joe Biden para abrir las escuelas primarias y secundarias, o sea, de kindergarten al octavo grado, en sus primeros 100 días? ¿Usted cree que sería posible hacer eso en nuestra área considerando el alto nivel del coronavirus?
So the question in English, I'll translate, is where are we with the Biden-Harris plan trying to get schools open the next 100 days? And I know I'd add to that as well, Governor Newsom, I'll answer in English and then Spanish. Governor Newsom has put some billions of dollars, I think it's $2 billion aside to help schools with early start. 100% supportive. I have been a broken record saying we should be putting our resources behind our youngest children who have fallen behind. Somebody said said to me something that affected me, that most kids drop out of high school in about third grade. They don't literally drop out of school in third grade, but they drop out of high school, in other words, by what happens to them around the third grade. And so our youngest kids losing a year means we're going to lose a whole cadre of our most vulnerable youth who won't go to college, who may not finish high school. And this has to be our highest priority. The next tier, part of the tier that just opened with 65 and over, is for folks that are in education and childcare, which need to be a priority, and food production. Not necessarily yet our restaurants, those are important, but food production, grocery stores as well. And I would like to see, as that capacity, that has to be the next priority. Those folks that are out there on the line, many of them still working, and that can get our schools back open. It will require 2 or 3 things, and I'm very heartened by the proposals of the Biden administration. 1, money. 2, testing. 3, a priority of vaccines for our critical school workers, and then being able to bring our young people back. We know our children won't get the vaccine. In fact, there haven't been clinical trials of them yet, but if the people working around them are getting the vaccine and are protected, we know that they are the strongest. My daughter is 9 years old. They are the strongest folks when it comes to getting COVID-19, and it's very, very rare to see severe cases, especially with our youngest children. So I'm very supportive of that. En español, yo apoyo el plan de la administración de Biden-Harris para abrir nuestras escuelas en estos próximos 100 días. Es muy importante y es el derecho de nuestros hijos y hijas a tener la oportunidad de aprender en nuestras escuelas. Pero necesitamos 3 cosas. Necesitamos dinero, necesitamos pruebas y necesitamos vacunas por las maestras, los maestros y los trabajadores en nuestras escuelas. Con esto tenemos mucha esperanza que nosotros podemos abrir, y con la ayuda del gobernador Newsom, $2,000 millones para ayudar en y este debe ser nuestra prioridad número 1.
We're almost done.
Sure.
Christopher Weber from the Associated Press, and you somewhat answered this, that the stated goal of Dodger Stadium vaccination was 12,000 a day, but we're at about 8,000 now. There's reports of long lines, but I know today they did get shortened a little bit. What are the reasons for the lines?
Yeah.
Do you want to talk about how trying to make it better?
Sure. I worked probably the hardest day yesterday. That was the 15-hour day, and we were supposed to close at 8. We had to make a decision. Do we close the gates as people were still lined up down to the freeway both directions and say, come back tomorrow? And I went to CORE and I went to LAFD and I said, how many of you guys are game to stay? Went to the clinicians who were exhausted, to the folks drawing the vaccine, and we all pitched in and said, let's do this. And I think the last person exited here around 11. 3 hours of extra in a 12-hour day ain't bad, but what was bad, yesterday was a beautiful day and a terrible day. Beautiful that we probably did more vaccinations here than anywhere in the country, if not the world, and a terrible day that some people waited up to 5 hours for that. So at the end of the day, we don't just go home. After an exhausting day like that, we start talking to each other. What do we need to fix? At the beginning of the day, we meet back out here. I was here at 7 this morning, and folks are here as early as 5:30, and as I said, some never leave the site. Say, how are we going to tweak this? I'm very proud. For everybody who was there and waited that long last night, and I said sorry to each one of them. 9 out of 10 was still very grateful. 1 out of 10 rightfully was saying, Mayor, this sucks. I can't not go to the bathroom for 5 hours. I have a dog here. I have an appointment, etc. We fixed it. And today, no more than an hour, but it is averaged 30 to 40 minutes at a site that didn't even exist before. So it's about those small improvements. It's about where we put the cones. It's about how we check people in. It's about how many people work the line. And I was out there kind of doing that troubleshooting, and it was beautiful to have hundreds of co-authors of this The first week you try to survive, the second week you try to improve, the third week you fine tune. That happened with testing, it's going to happen with vaccines, and this is going to be a site that all Angelinos can be proud of.
Maria Castañeda from LA Taco wants 2 questions. With the infection rate being what it is in Los Angeles, with the county passing 1 million cases earlier this week, do you plan on any closures anytime soon? And what are you doing to address possibly groups of anti-maskers that are going across the city? How will you protect workers? And it's expected to rain starting this weekend, with hypothermia deaths among unhoused people in LA being more than other cities, New York City and San Francisco combined. How would you address and support unhoused communities ahead of this weekend?
So a couple things. Let me start with our people who are experiencing homelessness in Los Angeles. Still very proud that all our constant outreach, and thank you to our outreach workers who we see and we thank and are doing heroic work in the midst of a pandemic. Over 30,000 wellness checks, masks, free on the street testing, and hopefully vaccines as we get the supply and they qualify. That'll be one of my top priorities of populations to get to, that there's a lower infection rate among people experiencing homelessness than people who are housed in Los Angeles. A lower percentage of deaths among people who are experiencing homelessness than people who are housed. But people who are experiencing homelessness have already a higher likelihood of death. It is a pandemic that predates this. So we open our winter and wet weather shelters. I will look for any guidance that allows from CDC or Los Angeles County Public Health to put more people in there that right now have had to be spaced out more because of this. And I'd like to get into our congregate shelters and see if we can get permission to do vaccines there first. So we can incentivize people to get there, incentivize them to get indoors as well and to be safe. In terms of anti-maskers, after we saw those incidents in places like Westfield, over in Fairfax District, made it very clear, and Chief made it very clear that we wouldn't stand by when that's happening. And in fact, when similar groups, it might have been the same group, tried to pull those things at the Beverly Connection and then going over to Westfield, they were stopped. They were told they'd be arrested. An incident this week, LAPD, I think, did either cite or arrest somebody. And we won't stand for that. People who are not wearing their masks, going into places where workers are working and abiding by the rules. I loved what President Biden said here today as well. That is a crime. That is something somebody can lose their lives from. And it's different than just somebody not wearing a mask walking on the street. This is conscious trying to harm somebody, and we know the science is very clear on that, and we will not stand by. In terms of the closures, that's a question for the county. I've always supported the public health support. I said, I think 3 or 4 weeks ago that I would have supported more. As we see the cases come down, that's a question, I think, for the supervisors and the county public health department. It may be that now, as we see a drop off of half or even 2/3 of some of the cases, that we may not need to close anything more. And that we have gotten through this right now, that our hospitals, stretched thin but have been able to hold on and not go into crisis mode, may not require any further closures at this time, but it always depends on our behavior.
And the last question I have is off topic.
Sure.
It's Joel Pollack from Breitbart News. Do you agree with the increasing criticism of DAs around the state relating to LA District Attorney George Gascon and his policies, liberal policies? And the LA Times recently said the Biden administration was following a California model for the country, Make America California Again. What would you recommend Biden copy from California, and what should he avoid?
MACA. I haven't heard that before. Make America California Again. I think California is an integral and beautiful part of America, and it is amazing that we have been attacked as if we were a forgotten part of it. Yeah, we have progressive policies, but we live here Democrats and Republicans. We probably have more Republicans in California than most states that are quote-unquote red, just in raw numbers, independents. But we're a place where everybody belongs, and we figure out a way not to make an enemy of one another, first and foremost. So that ethic, I think, is something America needs and was the core of Joe Biden's message. Second, yes, when it comes to the crises that we face, from housing to climate to immigration, trying to jump into that fray and not run away from it is absolutely what this country needs to do. Some are tougher than others. Homelessness is a brutally difficult problem to solve because it's mental health and addiction and trauma and building housing, which doesn't happen quickly. But we need national leadership. And I think that there are absolutely examples here of when you double down resources, you can double down solutions. But when it comes to the environment, absolutely. what Governor Newsom, what the city of Los Angeles have done to promote zero carbon economy, to create green jobs. That's absolutely a playbook for America. Why shouldn't they have green jobs in Appalachia? In the core part of America that built this country with the energy that stretched from the Gulf Coast up to the Canadian border, we should be reinvesting in a new energy economy there too. So this isn't just about LA. I don't want LA just to win this while the rest of the country suffers. I think California can help America prosper and, more importantly, come out of this pandemic. In terms of the criticisms, no, I think people jump on criticism before people even have the chance to implement policies. And I know that our district attorney is being thoughtful. I know he's listening. I know he's bringing new leadership. I also know that one of the things he will continue to do is not just look at what we can do to arrest and prosecute people. We pay a lot of money to see people go in and out of jail and back in. If we can get people to not reoffend, that is money always better spent. But, you know, I haven't looked at all the policies, Joel, you've asked me before. I've been so busy managing this. I looked at a number of them, and I do support them. There may be places where we tweak it. I don't know that he wants to mandate, for instance, that folks with who are the victims of domestic violence have to testify. That's something that has been effective when people fear testifying to get those convictions. We have some small differences of opinion in places like that. But we do need a different paradigm. We do need something that invests in stopping crime and preventing it from recurring. And so let's give somebody who is elected by the will of the people the opportunity to implement that. He should listen to criticisms, but it seems more like an attack and a caricature before he's even started.
Thank you.
Thank you. As always, I'm going to go into Spanish as well. So thank you, and I know folks have been hanging out for a while, but really appreciate you, and thank you everybody for tuning in English. Buenas tardes, Los Ángeles, y gracias. Hoy les hablo del estadio de los Dodgers, que ahora sirve como un sitio más grande de vacunación COVID-19 en los Estados Unidos y probablemente en el mundo. Desde que este sitio abrió la semana pasada, he estado aquí trabajando en cada función, supervisando las operaciones y determinando cómo podemos mejorar el proceso. Les cuento que he trabajado juntos a verdaderos héroes, quienes han estado trabajando aquí durante largas horas para distribuir esta vacuna y salvar vidas. Hemos tenido bomberos trabajando turnos de 24 horas, estudiantes de enfermería y farmacia, y compañías como Curative y Carbon Health, juntos con la Escuela de Farmacia de USC, LA Valley College, Glendale Community College y la Universidad Nacional. Cada vacuna que damos es el principio del fin de este terrible año que hemos vivido. Una cura para recuperar nuestra economía y poder estar juntos de nuevo. Esta noche me enfocaré en nuestro esfuerzo histórico de vacunar a cada angelino lo más pronto posible. Y les invito a registrarse para recibir información sobre nuestro esfuerzo de vacunación en la página coronavirus.lacity.org/VaxFacts. Hoy me acompañan los dos líderes en este esfuerzo que están ayudando a hacer este trabajo. El jefe del Departamento de Bomberos, Ralph Terrazas, y la jefa ejecutiva de CORE, Ann Lee. Y gracias por estar aquí conmigo. Esta vacuna es nuestro camino para salir de esta crisis, pero lograr eso tomará paciencia de todos. Nuestra ciudad tiene una estrategia de vacunación clara, enfocada en administración de vacunas rápida, segura, equitativa y a gran escala, para administrar más vacunas a las personas que las necesitan más. Nuestra ciudad ha vacunado a más de 8,000 personas en los 5 sitios de vacunación de nuestra ciudad. Solo esta semana le hemos dado la vacuna a 43,635 personas, un aumento del 90% desde la semana pasada. Aquí en el estadio de los Dodgers, esta primera semana hemos estado trabajando sin descanso para reducir los tiempos de espera. Pronto vamos a poder vacunar a 12,000 personas al día en este sitio. En este momento, las vacunas se están administrando a nuestros trabajadores de salud y de emergencia, y a los residentes y personal de los centros de enfermería especializada, y desde esta semana a las personas mayores de 65 años. Y estamos avanzando. Al final del día mañana habremos terminado de vacunar a todas las personas de los centros de enfermería especializada de la ciudad de Los Ángeles. Las personas de tercera edad que fueron las víctimas desaproporcionadamente a la empieza de esta crisis. En este momento, demasiada gente sigue muriendo de este virus. Por eso no hay nada más importante ahora que vacunar a todos. Como siempre, les digo directamente la verdad. La demanda en este momento es más alta que el suministro de vacunas que hay. Aún esperamos saber cuándo llegarán más dosis del gobierno federal y cuándo las cosas van a acelerar. Nos falta mucho todavía para llegar al final, pero seguiremos siempre adelante y siempre con esperanza. Y como siempre, tenemos la equidad al centro de nuestra estrategia de vacunación, trayendo sitios de vacunación a nuestras comunidades más vulnerables, en comunidades como el noreste del Valle de San Fernando, al lado este de la ciudad y también en el sur de Los Ángeles, por camión, por las peatones, múltiples sitios que nosotros podemos usar para distribuir esta vacuna. Igual lo aplicamos a todo nuestro trabajo en Los Ángeles. Hoy estamos lanzando la iniciativa Anti-Bias Learning for Employees, o ABLE, un programa obligatorio de formación sobre prejuicios implícitos para todos los empleados de la ciudad. Porque sabemos que tenemos que comprender nuestros propios prejuicios para corregirlos y que tenemos que enfrentar el racismo para eliminarlo. Actualmente hay 5 sitios de vacunación administrados por la ciudad de Los Ángeles, entre 98 totales en el condado de Los Ángeles. Y cada vacuna se administra en estos sitios de manera segura y por un profesional médico que está calificado y es confiable. Cuando sea elegible para la vacuna, puede hacer una cita en la página web coronavirus.lcity.org/vaccine. También puede visitar vaccinatelacounty.com para hacer una cita en sitios administrados en todas partes del condado. Si todavía no es elegible, puede registrarse para recibir alertas cuando se expanda la elegibilidad a más personas. Y después de verificar la elegibilidad y seleccionar un sitio de vacunación, le preguntarán por los detalles de su seguro médico, si lo tiene, y al final hará su cita. Antes de salir para el estadio de Dodgers, tenga su confirmación lista, su identificación y su tarjeta de seguro médico si tiene uno. Segundo, es posible que haya una espera. Hoy solamente es 30 o 40 minutos, pero ayer fue horas. Entonces use el baño antes de llegar, traiga agua y bocadillos y asegúrese de llenar su tanque de gas. Finalmente llega a la entrada, alguien le hará una verificación de elegibilidad y confirmación de su registración antes de dirigirlo a uno de los 3 estacionamientos. Cada uno tiene la capacidad de proveer la vacuna a 4,000 personas cada día, en total 12,000. Cuando ya esté allí, se alinea en una fila de 15 vehículos, se estaciona y espera a que un clínico llegue para confirmar su elegibilidad una segunda vez y asesorar su riesgo de una reacción alérgica. Le darán la vacuna, finalmente, que solo toma unos cuantos segundos. Después tendrá que esperar 15 minutos para asegurarse de que no tenga una reacción adversa a la vacuna. El proceso es seguro y simple, Pero si en algún momento hay un problema, un equipo de paramédicos del Departamento de Bomberos de Los Ángeles estará estacionando cerca para responder a una emergencia. Toda esta operación es el desafío logístico más complicado en la historia de nuestra ciudad, pero tengo mucha confianza y orgullo en este equipo. Y solo lo podemos lograr gracias al liderazgo de nuestros increíbles socios. El trabajo de CORE es fundamental para nuestros esfuerzos de vacunación. Y cuantas más personas puedan añadir a nuestro equipo de vacunación y pruebas, lo más rápido podemos dejar atrás esta pandemia. Entonces, necesitamos su ayuda, Los Ángeles. Buscamos personas para posiciones con o sin experiencia médica para trabajar en el estadio de los Dodgers, en nuestros equipos móviles y en los centros de asistencia peatonales de Los Ángeles. Si tiene un poco de tiempo extra o si está buscando un trabajo impactante, le pido que aplique. Solicite un puesto remunerado o voluntario en coreresponse.org/Get Involved. Además de las vacunas, hoy recibimos otra señal de esperanza. Hoy tuvimos 8.500 casos. La última vez que tuvimos menos de 10.000 casos en 2 días fue en la primera semana de diciembre. Gracias a su trabajo, gracias a su fortaleza, tenemos la oportunidad finalmente a reducir estos casos. Pero trágicamente, tuvimos 262 muertes. El nivel de muertes no es aceptable. Es una tragedia para nuestras familias, nuestras comunidades, y debemos continuar nuestro trabajo. Además que las hospitalizaciones por el COVID-19 en el condado por fin empiezan a estabilizarse. 7.073 personas están actualmente hospitalizadas con el virus, 7% menos que la semana pasada. Y a todos los trabajadores en nuestros hospitales, gracias. Gracias por su trabajo, su ayuda, su apoyo para nosotros. Así que mientras trabajamos con una nueva administración en Washington para aumentar nuestros esfuerzos de vacunación, sigamos haciendo nuestra parte como individuos para acabar con esta pandemia. No celebrar reuniones, por favor. Siga usando una mascarilla, por favor. Siga lavándose las manos. Siga practicando el distanciamiento físico. Así es como vamos a vencer este virus y finalmente empezar un nuevo capítulo en la historia de Los Ángeles. Entonces, quédense protegidos, quédense en buena salud y quédense en casa. Fuerza y amor, Los Ángeles.